This is Senior Airman Cespedes from Joint Base MDL Public Affairs. Today here with Lieutenant Colonel Kip, our Installation Public Health Emergency Officer. Sir, thanks for being here. Sorry we're such a weird distance right now, but we're trying to keep that 6-foot physical distancing.
No, absolutely, and thanks for inviting me.
Absolutely. So today we're going to highlight some key messages on what the base is doing to fight COVID-19 from a health perspective and answer some questions on what the Public Health Emergency Declaration Extension means for the base community. So why was a public health emergency declared this week? Why was it extended for another 30 days?
The extension really, following the news is we're still in the midst of this, right? So COVID's still out there. It's still going on. And so really the intent is every 30 days, and really before that we can look at it, but we're not out of the woods yet. And so really those authorities, those powers, those things, that unity of effort that it brought, it's not time for it to go away just yet.
So New Jersey right now, there's thousands of positive cases every day that we're learning about. So how are people still getting the virus in this region?
Yeah, so it's probably a whole bunch of different things. So one, similar to most viruses, we know that this one, and we're learning more about that people have it and don't know they have it, right? So particularly with our young military population, people likely can walk around with it, either have very mild symptoms, enough that maybe you don't realize it, maybe you think it's allergies, or really that you have no symptoms at all. It's really not unique to this. The flu does this. Most viruses, the way they spread so well is that they start spreading before you know they have them. So that's probably part of it. Two, like we have here on the Joint Base, we have people in the community that are mission essential, right? They're going out and they're carrying on their jobs. And again, it potentially puts them in exposure for, again, people with symptoms and those without. Certainly our communities still need to go out and do things they need to. We still need food and we still need to do those things. And then finally, I think there's a minority, right, of people that, and we're seeing this tension right now across the U.S. of people that we're getting tired, right? And so I think you're starting to see some people are relaxing a little bit more and maybe wanting to move out and kind of go back to their normal lives maybe a little earlier than we needed to.
Yeah, I miss just walking around and
Absolutely.
hanging with friends. So do you have a concern for community spread in our area, and what kind of precautions should people take?
Yeah, so without a doubt, I think right now the CDC, this was some weeks ago, the CDC did declare that there's widespread community transmission in the state as a whole. And really in the counties we saw that as well. And really what that means is that when you have community spread is that it's possible that someone is positive for COVID and ultimately you can't trace them back to someone else with COVID or a travel history, right? And so really they just sort of got the illness from the community. And really this aligns to really what we've been saying all along, and really it's no different than a flu season, is really it becomes down to some individual protective measures, right? So washing your hands, not touching your face, using hand sanitizer if you can't wash your hands, trying to minimize some of those trips, right? So if you are going to go out, make sure it's a worthwhile trip out, right? So try to batch those trips. Certainly if you're going to go to the grocery store, certainly don't hoard items, but make sure that you're picking up enough to go for a little while instead of having to make multiple trips in a week. Certainly things like cloth face mask coverings, that's about you protecting other people from you. That goes back to maybe you're one of those people with symptoms and you don't know it, and it's really about protecting others from you, so doing those things. And then when you get home, washing your hands, right? So after you're unloading your groceries, wash your hands and do those things. And really those, again, no different than most things. The cloth face mask coverings are probably the new thing for us. Mm-hmm. But really, I want to underpin that really doing things like hand washing, covering your coughs and sneezes is really the most important thing.
So cloth face masks are pretty effective?
So where we see their effectiveness really is that, so when you cough, when you sneeze, to be frank, there's spit, there's snot, there's other things that are coming out of you, and really those cloth face masks are there to stop that stuff from going elsewhere. That cloth face mask is not so much to protect you as an individual, but to protect those from you. And again, a lot of this came out at the time that we decided to do the cloth face masks. It was about as we started learning more information, and there's been some small studies that you can read about the number of asymptomatic people, or maybe pre-symptomatic, right? People that maybe in a few days from now will go on to feel ill, but right now they're not feeling ill, but they still have the virus.
Interesting. Okay. So you can be sick without actually...
Absolutely.
Interesting. So if you are sick, or you think you have symptoms, then what should somebody do?
Sure. So the first thing would be separate yourself from those around you, right? And so, certainly in my home, we've had the conversation that we would, the master bedroom's got its own bathroom and stuff, and if someone gets sick, that's where we're going to go, just to separate ourselves from the rest of the family. And then really, seek medical advice. So we've got the COVID hotline that works for the medical group. Please absolutely call. And then certainly, if appropriate, we'll test you. Now, really, testing is not going to change overall what we're going to do for you for the disease, right? So there is no effective treatment right now for COVID. There's a large number of treatments and testing right now. But really, the bottom line is we'll have some phone calls. So if we are tracking you, public health will call every day to check up how you're doing. We'll have a provider call you if they think it's appropriate, and really just help support you to get through it. That being said, from a public health perspective, I do want to know where the disease is on the joint base. And in some cases, I do want to be able to partner with our counties to make sure that we can do what we call contact tracing, right? So when we find someone that's positive, my public health team will do a relatively extensive interview with that person and try to trace everyone that they've come into contact with. So then we can reach out to them, assess for symptoms, and then also put those people in quarantine. Again, looking to try to break that chain of transmissibility for the virus.
I see. Interesting. So the medical clinic itself, what kind of operations have changed since the virus?
Yeah, we've done quite a lot, and it's been sort of a phased transition. So weeks ago at this point, we started screening people outside the door just based on travel history, back when travel made a little bit more of a difference when the virus, when it wasn't here in the community proper. And then I think most people now are familiar with, we're doing a lot of screening outside. And so really we've sort of set up operations outside on the pharmacy side parking lot where we can do both swabbing and screening for people, but then we're also doing some care, right? So if you do have respiratory symptoms, which potentially are consistent with COVID, but you need some health care, we do have tents where providers can do that care that we would do inside the building. Similar, like, the pharmacy has gone to operations outside, sort of a drive-through pharmacy, including on Saturdays for our retiree populations. Like most of America, we're really trying to embrace more telehealth and virtual appointments. And I think we're going to probably see that may continue after this is over. But really, so we do have bookable appointments for virtual appointments where we have approvals through Defense Health Agency to start using some other modalities, to start doing some video conferencing or some telehealth type things. And then certainly we've done other operations. So the Medical Control Center has been up. Certainly my public health team has been working nearly around the clock to do the contact tracing and keep up with everything. Mental health's been increasing their outreach. So really it's been a whole of med group approach to really get after this. And I think everyone here is taking very seriously the role that we're playing and trying to defend the base and take care of the people on it.
Interesting. So for testing specifically, what kind of people, who should get tested? And you do have testing capabilities. Absolutely.
So I think actually we were sort of on the front edge of testing for a lot of Air Force bases, and others are catching up to us now. But absolutely we do have testing here, and we're doing that out in the parking lot. And again, the idea being that you can drive up, don't have to come into the building, because part of it is trying to, inside the building, maintain ops as normally as we can. So for people that don't have symptoms, we do want them to be able to come in the building and feel relatively safe to the best extent we can. Recommend calling that COVID hotline. So again, they'll absolutely, we have nurses and ready to triage and talk to people about what their symptoms are. And more than likely, they may direct you to come in and get tested. If you call ahead, we'll have the availability to kind of give you a time range to come get tested. We'll say, here's an hourly range, and that way we can actually help expedite a little bit. Likely, if you get tested, you will get an isolation order from us or a quarantine order from us, and really that'll be until we get the test back. But really, at this point, I would like to test as many people as I can. I would really like people who have concerns for symptoms to call the COVID hotline and come in and get tested. Again, I'd like to be able to provide care for you. It may not change drastically what care we do provide for you, because again, there's not a good treatment for the virus just yet. But from a public health perspective, it informs how this base operates and informs certainly higher headquarters and everyone what's going on the installation.
Okay. So if someone has to physically report to work, what kind of methods do you suggest just for them to decrease their risk?
Sure. So some of this is working with commanders and working with leadership. So certainly, for instance, in the medical group, we've gone to split operations. The idea being that we don't have the whole med group here all the time, and we've sort of gone to some teleworking modalities so that if one of us gets sick, we're not necessarily quarantining the rest of the medical group. Understand that's not possible for everyone. So certainly things in the workplaces, if social distancing is possible, if it's possible to separate yourself from 6 feet from everyone else, that would be ideal. But again, accepting that may not be possible for everyone. And I think really it goes back to the same things we talked about when you go out.
So you said earlier about the whole physical distancing, how people are getting tired. What do you say to people who do want to have family gatherings or take their kids or just get out?
Yeah, it's difficult, right? I think certainly spring break was upon us, and I think everyone had much different plans for spring break than I know certainly my family did. And it's tough. This is going on for a while. I think we're all ready to be done. The challenge is we're not there yet. And so what people need to do is really stick with it, right? What I'd hate to do is make this all for naught. If we start mixing and intermingling and we see greater spread for the virus, it may force more actions to be taken, and we certainly don't want to do that. We want to keep a positive trend going. There's some early signs, hard to definitively say, but early signs that maybe the social distancing has been working, but our work's not done yet. And so I would say stick with it, right? The goal is the safety of you, your family, and those around you. And really the mission as well, right? And so our family members have a critical role in supporting the mission of this base, right? So, our active duty members that go home to those family members potentially, if they're out intermingling, could pose a threat to the mission of the base as well. And so really it's stick with it, right? So let's keep finding ways. We're talking about physical distancing, not social distancing anymore. Keep finding ways, right? So is it Skyping, telephoning family members, maybe dropping a text message here and there, and really hunkering down is the right way right now. The hope would be if we continue on the trajectory, if we keep on working hard, if we keep on fighting this virus, that we'll be able to at some point here start going back to maybe not completely normal, maybe some new type of normal, but allow us to start getting out a little bit more and getting back to those social functions that we miss.
So anything else that you want to tell our personnel, families?
I think just that, certainly the public health team and the medical group as a whole, we're all working hard, as is the installation leadership, right? This is a difficult situation to be in. I think, I don't think anyone taking command or really stepping in the medical group really thought, 6 months ago, 3 months ago, that this is where we would be. We're all working to make sure everyone is safe, everyone is healthy, and then ultimately that this base can keep doing some important work, right? There's a lot of missions going on in this base right now that are very important, not just to COVID, there are certainly those, but also our nation as a whole, and we can't let those fail. And so I think it's really about us working together and helping us get after this.
Well, thank you, sir,
Absolutely.
for answering our questions regarding COVID-19. Make sure to follow our app, Facebook page, and our website for more information on any COVID-19 updates. Have a great day and stay safe.